We did not have authorization to distribute. We were waiting for the protest to be over. We kept some for the victims of flooding. We just received the items and wanted to start distributing. We didn't ask the states not to distribute the palliatives. We were already distributing the items in Kwara before hoodlums struck. We kept them in anticipation of a second wave. I'm sure we're already used to those lines by the governors, CACOVID, Ministry of Humanitarian Affairs, all in a bid to exonerate themselves of the complicity in the COVID-19 palliatives distribution. I am Ukemere Tukwa, and you're tuned in to the midweek edition of COVID-19 Digest, one of Africa's channel of choice, AIT. Thank you for joining us at this hour. It is a looting spree across the country as many Nigerians have been engaged in what the social media users have tagged the ultimate search. Unlike the popular reality show that we all know and we're used to, this search is not just for a treasure that will lead to glory, but a search for food and for survival. It is quite unfortunate that some criminal elements have hijacked what started off as a peaceful protest to loot, maim, ransack, and arson public and private properties. It is not very clear how long the food items have been stored in these warehouses, but a close observation reveals that some of the food items donated by well-meaning Nigerians and other organizations through CACOVID to ameliorate the sufferings of the people during the COVID-19 lockdown were rotting away. How did things take a drastic turn from the streets to the warehouses? Nigerian youths were on the streets to agitate, but it was cowed when the military opened fire on peaceful protesters at Lekki Toll Gate. The military claimed that the protest had been hijacked by hoodlums and the need to restore peace and order was imminent. The shooting at the Lekki Toll Gate sparked another wave of outrage in Africa's largest city and spread to other cities where hoodlums took over the streets, the obstructions of the economic activities of the states, including burning down of critical government infrastructure and private property. Irate youth went on a rampage, stealing from both government and private establishments. The discovery of warehouses where COVID-19 palliatives were stashed introduced another dimension to the uproar. Public service holders, like the state governors, have been accused of hoarding the food items which they plan to use during political activities or divert them for financial gains. Are these wild allegations, or could there be elements of truth in them? Some of the governors have released press statements telling their own part of the story, ultimately to justify why the COVID-19 palliatives were not undistributed despite receiving these items from private donors through CACOVID. Borno State is one of the states that showed significant examples of how items of this nature can be distributed. Could it be because the state is not new to humanitarian crisis? Other states of note are Delta State, Rivers State. Governor Wike so far has been able to prove that they distributed the palliatives as they were received from CACOVID. Although CACOVID, the organization that organized the funding and distribution of palliatives to states, have released a public statement to defend their position in the scheme of things. They are, however, rarely available to respond to direct questions. We have made efforts to reach them through their feedback channels, but no response has come through yet. Our guest on today's episode had earlier warned of dishonesty by government officials in the distribution of palliatives received both locally and internationally, and the need to mount proper checks to avert diversion. The Executive Director of Civil Society Legislative Advocacy Center, Dr. Awal Ibrahim Musa, is our guest today. His interview comes up after we've given you the COVID-19 updates as released by the Nigerian Center for Disease Control. On the 27th of October 2020, 113 new confirmed cases of COVID-19 and 3 deaths were recorded in Nigeria. Till date, 62,224 cases have been confirmed. 57,916 cases have been discharged, and 1,135 deaths have been recorded in 36 states and the Federal Capital Territory. The 113 new cases are reported from 12 states: Lagos, FCT, Plateau, Kaduna, Oyo State, Rivers, Ogun, Edo, Imo, Kwara, Delta, and Kano State. A multi-sectoral National Emergency Operations Center activated at Level 3 continues to coordinate the national response activities.
We have, expressed concern that the COVID-19 and the palliative that were supposed to be given to Nigerians may likely going to be diverted. We raised this concern long ago because of the influx of money and food items that have come in, and because of the entrenched culture of lack of transparency and accountability in Nigeria. We express concern that the palliative are likely going to be diverted or misused or stolen. 3 months after this, we are now being vindicated that palliative that were meant to be given to Nigerians who were in their needs of food items to survive as a result of the lockdown, as a result of the COVID-19 pandemic. Some wicked people at local level, state level, and national level decided to divert and hold these food items. Some of it, they are even about to expire. Some of these items, some politicians or some people in government, they claim that they want to use it during their birthday or during their political activities. The question is that this is not a personal items. These are items that were procured by the Nigerian government with its resources, public resources, and also donation by well-meaning Nigerians who wanted to save and support their fellow Nigerians from the hunger, starvation, and the crisis they found themselves as a result of the COVID-19 and the lockdown. Now, the Federal Ministry of Humanitarian Affairs, they distributed this palliative at local government, at state level, and even at federal level. But what was lacking, in my opinion, was that you cannot simply hand over these items without ensuring that it gets to the right persons. So the ministry had responsibility to ensure that they did not just do ceremonial handover these facilities, but they should be able to have independent monitoring groups that will ensure that these palliatives are not diverted, are not stolen, are not hijacked by wicked people. Secondly, the National Assembly, they appear to have abandoned their own responsibility in terms of oversight on the palliative. The relevant committees in the National Assembly should have ensured that Nigerian people get this palliative, not that some people will go and store them somewhere and then use it for their political activities or for their social activities, like we have had. One of the official was been alleged to say that he was going to keep it for his birthday. This is unacceptable, and this is what is contributing to the ongoing crisis we find ourselves in Nigeria, where many Nigerians are starving, they have no job. In fact, to tell you the bad situation in the country, even offer for employment allegedly being sold in millions. This is not going to bring stability and peace when majority of Nigerians who deserve to be given decency of life, who deserve to be given job opportunity, who deserve to be given support, some people, some few individuals would corner this support. So both the COVID diversion and even the misappropriation of probably the loans collected, to deal with COVID-19 pandemic, and also the uprising by the young people as a result of the poor governance in the country are all manifestation of what we have been calling for reform in the past. So we hope that Nigerian government would take lesson and be able to deal with all these, lapses that is creating this unrest in the country. Let us face the truth, and it is important that the governors in Nigeria who did not distribute this palliative to simply apologize to Nigerians that they did not do that, rather than bringing in excuses. You cannot, on the basis of your anticipation for, another wave of pandemic, not to provide the essential, the food items that people needed to eat. People were starving. People were hungry. It is your responsibility to ensure that you provide that support to them. If there's any, another wave of pandemic, as we move on, so that this food don't expire, okay? This food and drugs and other facilities did not get spoiled. Now, what we have gathered is that some of these items are about to expire, and you do not know when the second pandemic is going to come. Why are you even anticipating it instead of you to begin to think through scientific way to find, drugs, to find, vaccination that can deal with this? Why are we always not, serious in this country? I think, in some states, and I want to specifically commend the Kano State Public Complaint and Anti-Corruption Commission that has actually arrested some local government chairmen who were actually hiding the COVID palliative. They were the only state and the only agency, not even, apart from the ICPC, that have also uncovered some money that is meant, related to the COVID-19. It was only the Kano State Public Complaint Commission and Anti-Corruption that demonstrated seriousness by arresting some local government officials, including local government chairmen that were in the character or in the habit of, hiding the COVID. So why can't other states take a cue from the Kano State Public Complaint Commission and Anti-Corruption to also deal with any government official, unless they are all conniving to deprive, their people in their state? Otherwise, there's no justification for whatever they are coming up with. And we commend the Borno State Governor for being, a really leader who cares for his people, and some other state, governors who also use judiciously the palliative to support the people who were in need of that. So no justification. We totally reject the explanation by some of these governors, because we believe that if Kano can distribute the palliative, if Delta can distribute it, if Borno State can distribute it, why not? If, some other states, they distributed it, why must they now justify holding it or diverting it? This is not good, and this is what is creating more disconnect between Nigerian people and their leaders. If Nigerian leaders are truthful to what they are doing, Nigerians will believe them. But when you are coming with this kind of explanation, there's no way Nigerian people will have trust on their leader. So I want to use this opportunity to please call on the governors to withdraw that statement, because some other governors, they distributed the palliative, and some other, state government, they also take, action against those who were attempting to hide, the palliative. So we need to be very careful in dealing with this issue now. The first thing is that those people who have deliberately went to loot public and private properties, they committed offense. Those people who went to, discover palliative that was meant for the general public consumption, and they took out the palliative, I did not think that they commit the same crime like the one they have gone to, destroy public and private properties. This is the reason why if you don't address governance, if you are not transparent and you are not accountable in what you are doing, this is the repercussion of what you are going to see. So governments had made mistake by allowing those officials to divert the palliative, hide it, deprive Nigerians from accessing this in an orderly and responsible manner. So therefore, government, on the account of that, I did not think that they should punish those people who have gone to eat the foods that were meant for them, because government failed to distribute these food items, which included private and public contribution. Nigerians contributed money to procure food items for Nigerians who are in need, who are in need of these food items, and you deprive them, and you corner it. You want to go and sell it, or you want to go and do birthday, or you want to go and do political, activities with it. I think government need to distinguish between those, two cases. I am in support that anybody who goes out to destroy public facilities or went out to destroy or vandalize private facilities like the one we have seen, destruction of the NPA, Nigerian Port Authority, destruction of the police station, destruction of the TVC, destruction of TV Continental, destruction of so many privately owned properties by Nigerians, by fellow Nigerians. Those who have done that, they should face the law, because you cannot, turn the peaceful protest into a criminal protest. There's a difference between the protest that began at the early 2 weeks of the protest. That was a very genuine and sincere expression of dismay of the state of insecurity and bad governance in Nigeria. The one that took place after those peaceful protests were protests, or rather were people who were waiting for opportunity to go and steal public and private assets, and we must distinguish those two. If you continue to use immunity to continue to unleash terror and deprive your citizens, the problem that you are going to have with that is that first, there will be total trust. There will be total mistrust between the people and the public officials. Number two, you will also continue to create crises with your hands, because as long as you continue with this criminal diversion of public facilities, as long as you continue to deprive the people, as long as you continue to encourage corruption and misconduct in the system, then you will continue to create this army of unrest. And this is not going to be good. Already the country image is battered. Rightly or wrongly, some people have even gone out of the country demonstrating, calling for even sanction, which I don't support, because already Nigerians are under severe sanction. Nigerians are barely, surviving. And when you call for international sanction, you are going to kill more Nigerians, because they cannot even access anything, including medicine and what have you. Already they are being, subjected to this, hardship by the wicked public officials. Now, if you call international sanction, the public official, many of them, they even have two passports. They have either European passport or British passport or American passport, or even some other countries in Africa. And some of them, they have, even stolen enough to take care of themselves outside this country. So if you call for sanction, you are not being patriotic, because you are going to unleash more sanction, more suffering for the ordinary Nigerians. So we don't support call for any sanction, because the consequences of it is that the same ordinary Nigerians will suffer more. Already you can see, for example, as a result of the COVID-19, many, medicine that's supposed to have come for the consumption of ordinary Nigerians is not getting to Nigeria. Many, things that will have been used for the ordinary Nigerians, even without sanction, because of the COVID, situation, is making it difficult for Nigerians to access it. So by the time you call for sanction, it means that medicine cannot come to Nigeria. Other things that are essential, that is meant to support Nigerians to survive, they will not be able to have it. So it is not a wise decision. We discourage this kind of call because it's not patriotic call. We have responsibility as Nigerians to ensure that our leaders are accountable. We have responsibility as Nigerians to ensure that governance work. We have responsibility to ensure that the electoral system that gives them the opportunity to come, is amended or is reformed to ensure electoral transparency, to ensure electoral reforms that will guarantee, Nigerians who have the intention and who have the skill, the knowledge, the capacity, the integrity to be able to go into different, elective and even appointed position. We had called on government to ensure that the distribution of palliative is inclusive, meaning that in every local government you are going, there should be representative of community leaders, religious leaders, community-based organization, NGOs, lawyers, journalists, and government officials. If you bring all these stakeholders to do this distribution of the palliative, there will not be any room for anybody to divide this palliative. The government refused to listen to us. And in fact, we even told them that they should include EFCC and ICPC in the committee that will distribute in every local government. But because they don't take civil society advice, they ignore us. Now, you can imagine if you have EFCC, ICPC, MBA, NUJ official, civil society organization, community leaders, religious leaders, even labor union. If you have all this in each of the local government where you are going to distribute the palliative, tell me which government official can have the courage to divide or hide, or to steal the palliative. It's not going to be possible. So, but because the system or the distribution mechanism was faulty and they were not ready to listen to us, that is why we have seen what we have seen. If they have taken the advice that CISLAC, right from the beginning, advocated by having these inclusive stakeholders in the distribution of the palliative, we will not have this case of diversion, hiding, stealing of the palliative.
And now for your Healthline. Globally, there has been more than 43.8 million confirmed cases and more than 1.1 million associated deaths, according to Johns Hopkins. The United States has reported 8.7 million confirmed cases. However, due to a lack of testing, the number of actual cases may actually be higher. Wendy Barclay, the head of the Infectious Disease Department of the Imperial College London, pointed out that the novel coronavirus seems to follow a similar. The National Institute of Allergy and Infectious Disease Director Dr. Anthony Fauci said that we should know the COVID-19 vaccine is safe and effective by early December of this year. He also said the widespread vaccination is still not likely until later in 2021. The antiviral drug Remdesivir has been approved by the United States Food and Drug Administration for the treatment of patients 12 years and older with COVID-19 who require hospitalization. The approval is based on 3 randomized controlled trials, including the recently published final results of the National Institute of Allergy and Infectious Disease. At this point in the pandemic, over half of all Americans have been personally affected by COVID-19, according to a new Health Day Harris Poll online survey. Swiss hospitals are scrambling to cope with the surge of arriving COVID-19 patients, hauling staff out of the retirement to replace sick frontline workers and closing other wards. An official warning that they could reach breaking point in about 10 days. New cases numbers have surged to records in recent days in Switzerland, with the infections rate far exceeding those in neighborhoods such as Germany and Italy, and fatigue amongst the staff is on the increase. Geneva is one of the worst hit cantons, and COVID-19 cases at Hague has increased more than 6-fold in 3 weeks, its director, Bertrand Levart, told Reuters. Thank you so much for staying tuned to this week's edition of COVID-19 Digest. I'm Ukemere Tokwa. Stay safe.